welcome to Ebru today, Dr. Nwando Anayoku from Children's Hospital of New Jersey, here now to discuss a growing problem that is childhood asthma. So good to have you here, doctor.
Thank you for having me.
First, can you define what is childhood asthma?
Childhood asthma is a chronic disease of inflammation of the airways, of the lungs in children. And children can get it over and over again whenever they encounter factors that might trigger it. And trigger is a key word because people have asthma that's triggered by different things. So some children get it when they've been running, some children get it when they've had a cold. It flares up basically, but it's an underlying chronic illness that shows up.
You have seasonal allergies, and sometimes kids will get a cough or have a hard time breathing. How do you diagnose?
That's a question that a lot of parents ask. Can my child be tested for asthma? You can't really test for asthma. You diagnose it based on history. You diagnose it based on, they have a certain set of symptoms that occur under certain circumstances over and over again. I guess the closest thing to a diagnosis is if you come into a hospital or come to the doctor's office and you are given, we measure your baseline lung function.
Right. So you're really looking at symptoms. What symptoms do parents need to be looking at? Because coughs and wheezing can be confused with the common cold. So what are the red flags?
The cough, the common thing to remember, everybody thinks of asthma and thinks of wheezing. So the child has a noisy breathing. But asthma is not all about wheezing, and especially in children, is very often all about cough. And they tend to have a lot of nighttime cough, and sometimes they have cough until the point of throwing up. And they'll have that cough after exertion. So they've been running and playing, and all of a sudden they come down coughing. That kind of pattern starts to tell you that there's something to look out for. The other thing to know is if you have a family history. If there's anybody in your family who has asthma or allergies or any of what we call atopic syndrome, so which means I tell my patients you're sensitive. You have sensitive skin, you have eczema, you have sensitive lungs, you have asthma. And that picture of things tends to run in families. So if you have a family history, it's more likely that this cough and wheezing or this cough picture is likely to be asthma. But you must have a conversation with your doctor about it. Parents are afraid of the word, but I tell them, don't be afraid of the word. Don't be afraid of it. If asthma is what we have to deal with, then we have to name it so we can handle it. If you call it everything else, you'll never handle it.
Now, is the cough different? Does it sound different than other coughs?
It does sound different from other coughs.
What does it sound like? Is it a dry cough?
It's dry often, but it's really deep, and it comes in like phases, like spasms of it. So they'll say, oh, she was coughing and coughing like her lung was trying to come out.
Can you can I put you on the spot? Okay, all right, I won't put you on the spot then. Okay, but now if a child has asthma, are they going to have it throughout their life?
So, and that's important to know, because if you have asthma, there's, we have the entity of childhood asthma, because there are a lot of people who just have the symptoms in childhood. But there are also a lot of people who continue to have it as they get older. So some people grow out of it. I try not to use that term because if you're prone to it, you could someday in your life meet something else that triggers it and have those symptoms later. So you can certainly go on into adulthood with asthma, but a lot of people tend to get better as they get older.
Is there a way to prevent asthma?
Not to prevent having the condition. If you have asthma, you kind of have it, but you can prevent having flare-ups. You can understand what triggers your flare-up. So if cut grass flares you up, then stay away from that. If you're exercising, my goal always is to make sure that a child can live the fullest, most normal life that they can. So what do? You can take an inhaler right before gym so that you can have gym, but you don't have an attack afterwards. So it's just to know. So children can keep up with activities. They can participate in sports. Absolutely.
But what I'm hearing from you is making sure you're getting the right medications and taking those medications, which is a parent's responsibility, because little kids often will forget.
Absolutely. But you know what? As they get older, as they get to be teenagers, the kids feel better if you give them some control. So if they get to understand this is how I feel when I start to get sick and this is what I can do, having some control over their condition makes them feel a little bit more empowered, other than being helplessly waiting until it knocks them down again.
Yeah, now, does pollution lead to asthma?
Pollution certainly doesn't help asthma. If you look in areas where there's increased pollution, you find higher incidence of childhood asthma, even adult asthma. So yes, pollution is not a good thing for anybody.
I want to wrap this segment up by final thoughts, final words for parents. If their child has a cough, what they need to do, what they need to look for.
Don't focus on the cough. But if you have a cough that you can't get a handle on, absolutely talk to your physician. Tell your doctor that this is what's going on, because you try all those over-the-counter cough medicines that they don't help when you have a child with asthma. So talk with your doctor. Asthma is not always about wheezing. In children, it's very often about cough, and parents should remember that.
All right. Thank you so much for your advice and insight.
Anytime.
All right.
Thank you very much.